Good afternoon, everyone. Aloha, talofa. I'm Holly Manaseri, a faculty member here at the Center on Disability Studies at the University of Hawaii at Manoa, and I'm pleased to welcome you to today's partner seminar. We are recording this session, and it will be available on our CDS YouTube channel, so we will be sharing that link at the conclusion of this session. Just a few reminders, you can feel free to turn off your video during the presentation, and we do ask you to please mute your microphone until we have some time at the end for question and answer. Please use the chat for comments, though, throughout the session. We'll be monitoring those and making sure that they do get shared out here at the end. We have enabled the caption feature. And please let us know if you have any accessibility concerns or need us to address any needs. First, just a little bit about our partner seminar series. The Center on Disability Studies is proud of our numerous community and agency partnerships over the history of serving as Hawaii's University Center for Excellence on Developmental Disabilities. Every other month, we spotlight one of our partners and let them share more about who they are, the work they do, and the ways they have partnered with CDS. We hope this sparks new or expanded collaborations for those of you attending, and also helps to deepen our understanding of these wonderful partners, agencies, and individuals doing such amazing work in the area of disability supports. So although we still have some people coming in from the wait room, I do want to be mindful of our time. And I am going to turn this over to our presenter, Tafa, to introduce herself. We're just so excited about the topic area. And we know that there's a lot of interest. It couldn't be a more relevant topic. And we're so fortunate to have her join us today. So Tafa, we'll turn it over to you.
Good morning, and thank you. First of all, I just want to say thank you so much for the invitation and extending the Pacific connection to American Samoa to share our stories with everyone. So today's presentation is basically going to just cover a prelude to the Pacific Rim post-conference that's going to focus a lot on inclusive emergency management. So I'll go ahead and do a quick slide share of today's presentation. Today it's going to cover more of the Pacific way of what does inclusive emergency response or recovery look like on your island. And I do understand we have a wide registration to also include CNMI, Hawaii, and American Samoa. So this is going to be from an emergency management engagement, but from a disability and access functional needs lens. So this is very important to step back and take a look at, because this is from the real experience and the missing pieces to kind of like bridge the gap to resilience. So as Holly had mentioned earlier, the network connection with American Samoa's USAID and the UH. We are part of the Pacific Basin University Center for Excellence, located at the University of Hawaii. We've been part of the Pacific Basin since 1993. Since 1993, I've been here since 1994. So it's always good to share the work that we do and the history with it. Our core functions has a lot to do with interdisciplinary training, training TA, research and dissemination of information. And so we do this through several activities. Some may know us for special education, some could be health initiative. And in this specific case, it has a lot to do with emergency preparedness and management. So our mission is just to assure that individuals with developmental disabilities of all ages and their families participate fully in activities that will design and promote self-determination, independence, integration, and inclusion in all facets of life in American Samoa. And in this case, it has a lot to do with emergency response and recovery. So the objective for today's webinar will focus a lot about the valuable role and responsibility of the Disability Network in emergency preparedness, and then trying to get everyone to the Disability Network and other organizations to get familiar with their own state plan, state emergency operation plan, and federal policies. And in many cases, you're going to find that federal policies is the roadblock. So there are some political insecurity that keeps us from responding to or recovering. Also, to talk about key stakeholders to build and coordinate resources. And then we cannot forget about our Pacific culture, is the fact of trying to illustrate cultural resilience when rebuilding the who in the community. So as mentioned earlier, the delivery of this training, of this webinar, is going to be, if you're a government representative, it's going to be you looking into the disability community. And if you're from the Disability Network, you're going to look outside. So it's the outside looking in and then the inside looking out. So just a quick explanation. Sometimes we talk about emergency management, and then we say emergency preparedness, then it's disaster management and disaster preparedness. So what's the difference? I like to be consistent with the federal language. So when we say emergency, I like to go with the declaration. If it's an emergency declaration, it's emergency preparedness or management. And then it's major disaster management. And so you from the Disability Network or the general public, you want to pay attention to which declaration is being mentioned. And so if it's a major disaster, know that there's a wide range of federal assistance now that's going to help respond and help you recover in the community. Okay. If it's emergency declaration, there's a limited funding and limited amount of assistance that can help respond locally. Okay. So I think about the valuable work that we do in the Disability Network to also include aging. We as a Pacific region, we've done a lot in engaging in community preparedness. And then we are pretty much experts in the field because we know what exists in the ground. We know the community. We know the people, who lives where. We know who is reliant on electricity. And then we know what resources are needed. We know where to get it. And then we know what communication needs to be more accessible for the general public. That includes the disability community. And guess what? While we were working on the community level, preparing the household, everything what needs to do, the territory was doing their thing, and there was no connection. So while we're doing the preparedness here at the territory lens, who knows what exists in the community? And I can comfortably say that this has always been an ongoing problem when it comes to responding to a disaster. There's always a disconnection with the emergency management and the community because there's no, there seems to be, the question would be, how well do you know your community as an emergency manager? And if you know your community well enough, you know what resources should have been on the ground pre-disaster. Yeah. So as we go through slides, we're going to talk about more and more why there's a gap, and then what we can do when we walk away today to bridge that gap. So I like to use the NIMS. The NIMS is actually really a framework that's scalable, and it can downsize, it can broaden depending on the disaster. So this is really a framework that the federal government uses and across the nation. So even though this is from a disaster management lens, I will only apply from the disability integration side what I see and what I think we need to start having more conversation about with the emergency management administration. So National Incident Management System, there are 3 components. One is resource, command, and coordination, and then you have the communication. So if we were to take a look at this, I'm going to hit the command and coordination first. So in the command and coordination, there's 3 ways to respond to it. It could be on the site, which is what they call incident command system. And then there could be an emergency operations center off-site in another office, or it could be multi-agency coordination. So this is what they call a joint information system. All 3 spaces talking to each other. Okay. So I am going to hit the incident command system. So think of it like an organizational chart. You have a commander, then you have the command staff here, which consists of public information, the safety officer, and the liaison. So this specific space here, they're really responsible for a lot of, other than their own role and responsibility in general. They're really supposed to focus a lot on policy guidance, and they have easy access to the senior level for decision making. So if I was to think about it in an active disaster, and this is very common across the nation, in an active disaster, the federal side would have a disability integration advisor on the site. In an active disaster, you have the state and you have the federal. Whenever the federal team comes down, there's usually a counterpart from the state that basically lines up with the federal side. In the disability integration space, that does not exist because at the state level, we do not have a full-time disability integration advisor. And the same applies to many states. So the islands, territories really don't have one. And I think the only state that I know that do have one, and I could be wrong, it could be updated, is the state of California and Nevada during the COVID. So when you have counterparts that are not present, guess what? Do we have to wait for disaster in order to happen to get a disability integration? Then you'd get disconnected of how well do they know our community? And then how well do they know our culture? So this has always been the missing link pre-disaster. So I think about the pre-disaster, if every state and territory had a full-time disability integration advisor, pre-disaster, they can play it a lot, and then what so much effort from the disability network does not necessarily have to put so much energy and resources to retrofit in a set plan. So they can work on trying to see what can be done to tweak the emergency support functions in the EOC. They can take care of the ADA access in a shelter facility. They can actually help assist in doing communication templates to make sure the information is accessible for all, and make sure that training is updated with, the community organization, the disability network, and many of the government agencies. So again, if you think about it, imagine what these NIMS would look like if there was a disability integration sort of integrated across this entire framework. So we're going to hop on over to the resource management. And one thing I want to ask is that, do you have mutual aid partners on the ground? And so mutual aid partners could be anyone that has all the resources to assist you on the response. You don't have to go buy it. You have this agreement. They're willing to provide whatever resources. For example, the beautiful village of Whangasao, where I'm from. Whenever there's a landslide, there's that one contractor, because of a mutual aid agreement, that would come, bring out their excavator, and they would clear out the road, so we don't have to wait for 2 days for the road to clear, or somebody to get an agreement with a contractor to come out and clear out the road and remove the debris. In many cases, debris removal is just as vital for people with disabilities, because when debris is blocking the sidewalks and the road, and there's huge rocks, boulder rocks from the ocean, guess what? People with disability cannot access just to get to the main road to go get help. So things like that is just as vital for the disability and aging community. The EMAC is very tricky. They call it EMAC for short. So EMAC is basically having the state-to-state agreement in the same manner of mutual aid, and you can get resources from your neighboring state. But Pacific Islands is very different, right? So one thing challenging about the EMAC is that there is always a barrier because of federal policies such as the Jones Act. So for some of you that may not be familiar with Jones Act, the Jones Act is similar to what we can say cabotage law for air carriers. For Jones Act, foreign vessels cannot enter, cannot have a direct 2-point entry into another U.S. Jurisdiction. So the Jones Act affects the state of Hawaii, the territory of Guam, Puerto Rico, and Alaska. It does not affect the small islands, which is American Samoa, Sinai, and Virgin Islands. But guess what? We still have to get to Guam, we still have to get to Hawaii, and we still have to get to Puerto Rico in order to get resources. So you have a federal policy that sort of hinders the whole concept around the EMAC. And I think about the story that I heard that occurred with Guam most recently, of trying to get a bucket truck to help fix the electricity. I think it's supposed to be electrical pole. But the nearest bucket truck was in Sinai. And because of the Jones Act, you couldn't get it over there. You couldn't want something so simple and so cheap to get it next door, and you had to get it shipped out of the state of Chicago, right? So not a problem if the declaration is 100% federal funded, yeah. But when there's a matching, a 10% matching imposed on the state or the territory, it can be costly. So these are conversations that needs to take place because EMAC is more of a congressional level conversation. And then the one thing you want to see is that, are you part of the VOAD? If you're not part of the VOAD, who's part of the VOAD? The VOAD is such a resourceful organization that basically brings faith-based organization, nonprofit, other government agencies who does human services come together, and they make sure they don't duplicate efforts and resources. Everyone has a shared role and contribution in the organization. One thing I cannot forget is that you want to make sure pre-disaster that this may sound ridiculous, but my ears and my eyes are glued to the shipping containers that come into our territory. And the reason why the shipping container is such an important part is because they help keep our economy stable. They bring our resources to the island. And so, you know, you can also resonate in many ways when we fly in on Hawaiian Air every Monday and Thursday, everyone's bringing containers. It's containers full of resources. And the same goes with our shipping vessels. So when there is a turnaround on a shipping vessel because there may be mechanical problem or there's a delay somewhere, you want to pay attention. Because when a disaster happens, you're going to end up seeing something like this. And the reason why I like to talk about food insecurity / security is because at the end of the day, our moms, our children, people with disabilities resources on there we're gonna struggle because of the small specialized food that they need. And so in this picture I took in 2018 when we had the Gita disaster, and this was important because at the time, you know, if you're not familiar with WIC across the nation, you only can use these vouchers for the approved products on there. And so when you don't have the approved products on island during a disaster, guess what? So about now, how can we find alternative solutions? We did have a conversation with FEMA about this 2 months ago. And so there is they will revisit on how they stock at their distribution center out of the state of Hawaii. One thing that we could have, from the Pacific standpoint, take a lead on is that if there was more attention paid to this incident, we would not have gone through the formula shortage that happened across nationwide. This photo took place in 2018. We advocated so many times in different recovery spaces about this, but no one saw it from a national level. And so there was a formula shortage that happened during the COVID time period. And so again, one of the resources you want to take a look at under individual assistance is not just housing, but crisis counseling. I want to hit a little bit on the disaster legal services because currently right now we have a shortage of attorneys here in American Samoa. I'm not too sure about the other territories, but in 2018, our legal aid office had to reach out to the Bar Association nationwide and basically found some attorneys to help out with some of the cases here pro bono. The other thing is about the unemployment assistance, you as a disability from a disaster. And so this helps with the recovery and getting them unemployment assistance. Okay. So now that we're done with the resource management, we're going to hop on over to the communication side. So the one of the main principles around from this is, you know, how do you maintain communication and connectivity to the general public, also providing situational awareness. And there are two main parts for the public information. One is the alerts and warnings, and then the second is press conference. One thing I want to mention about the press conference before we go to the alert is that during COVID, we didn't have enough sign language interpreters. And so what happened was that there was not enough coordination of scheduling. Sometimes, like out of nowhere, they would say, Tafa, are you willing to sign like in 30 minutes? And guess what? I have either had a scheduled class or I have a scheduled meeting or presentation that conflict with the interpreting. So when we had contracted in sign language interpreting service, they provided the interpreting, but the disconnection with our deaf community added more confusion, simply because our local community relied a lot around local signing. So you get someone from the U.S., which we found out later was from Virginia, signing American Sign Language, and there was a large disconnection with understanding what the message was supposed to be delivered. So early warning system. So, you know, back in 2018, FEMA pushed out a presidential alert. And at the time, American Samoa, Guam, and the Commonwealth of Northern Marianas, Commonwealth of Northern Marianas, we did not have a WIA emergency alert system. And so there was not a full understanding at the federal level about our service providers. Some are foreign owned and some may be locally made, but there was a automatic assumption because we were U.S. territory, we would get the WIA alerts. The problem here in this space is that unlike emergency alert system that is often broadcast through TV or radio is a requirement versus the WIA, it's voluntary for a service provider. So this woke up, obviously, Guam made sure that they advocated and said, you know, we want to be included in this alert, simply because it was at a peak political peak, when there was a lot of concern of what was happening with all these conversation with North Korea. And then island-wide, when there was a missile alert in Hawaii, there was so much focus on the error that nobody was having that conversation of who didn't get the alerts. So because we're always forgotten, I think this is the part we have an opportunity to say, call up people in the disability community and say, hey, did you get the alert? We want to make sure that they got the alert in case it was accurate. And then also, of course, living in a community where there's a lot of trees, mountainous area, a lot of times the sirens will absorb the sound. So these are things that why WIA alerts can be just as valuable when sirens are not working or when you can't hear a siren. So October 4th, there was a national WIA alert that was pushed out. And I always want to ask everybody again, did you get the alert? Important to ask the disability community to see who didn't get the alert. So we did a rapid assessment during COVID about delivering the message. And so we collected data from 540 participants. And as you can see on the left, this is the large group of ethnicity. We ended up working with the very ethnic communities that in American Samoa that completed the survey. And when it came to the COVID information, the preferred language of comprehension was really English. And this was very important when we want to talk about eliminating misinformation. So this is always good to know to better get information out. And again, the trust of information was really from a high peak from the healthcare providers. I want to also talk about accessible actions, and this was very important for me. I personally went through a tsunami here in American Samoa, many of us here on the island, that we need to talk about accessible actions other than the alerts. So if this is the tsunami alert, and we know our community in our village, and if a person does not have a vehicle, you may want to tell them that maybe you need to start transporting at the watch level, because it may take time for the vehicle to get there to pick them up and then help them out to evacuate. Again, do not rely on the government, because your resources should be within reach. So let's talk more about accessible action offline. So as we're approaching the end, I think this is one of the questions we need to start talking about. Recovery is, how do you measure inclusiveness? Because whatever you see can be tweaked a bit to be more inclusive. During your recovery, you want to make sure it's present pre-disaster when you want to start planning again. And last but not least, I shouldn't say last, because this is not the last slide, it's almost to the end, but I cannot forget the fact that I'm a Pacific Islander. The way we construct as we meet new building codes to recover, build back better and stronger, we want to still make sure, how do we preserve our cultural way of construction, whether it's farming, traditional home, green infrastructure. We want to make sure we still find ways to preserve the cultural traditional knowledge during recovery and make sure we can integrate into a plan. Now, this is going towards the end. One thing I wanted to share, and I'm still learning, is that the White House pushed out a new strategy plan nationwide called the Gender-Based Violence Strategy Plan. Under Pillar 6 of this strategy plan covers disaster recovery and response. This is still a new conversation in the disaster space, and I was asked if I would be interested to chair the subcommittee for the gender-based violence, which I happily accepted under the FEMA National Advisory Council. We're still trying to learn more things. It'll be out of the, I think it's the U.S. Department of Justice that will oversee this, but it's something that we need to start talking more about in shelter facilities or outside of shelter facilities during a disaster or after. Okay, so here's my contact if anybody has any more questions. I'm sure you'll see it on the link that Holly and Max will share later. I also want to make sure there's resources available. I did include the Google Drive link in the chat box. One thing I want to share is that this second bullet, help after a disaster, is translated in 25 language. I've uploaded it in this share resource folder, the English, Samoan, and Chamorro language in there. So yes, they got Samoan language in there, which is fantastic. So feel free to pull it from there and you can help disseminate. And here's the reference. And that's it. Any questions?
Tafa, I have a question. You've highlighted so many important strategies and as well as the issues of concern. From the conversations you're involved with now at the national level, could you share a little bit more about the ways that disability is being more at the center of emergency response? Are you seeing conversations shift in terms of other national organizations such as the Red Cross or other major entities needing to think about their integration of disability content? And could you share a little bit about what's happening?
So yeah, in that resource folder, you will also find the FEMA National Advisory Council recommendation report, and that report was given to the FEMA administrator, Diane Creswell. The one thing I can say about that report is that there's a large number of recommendation that covers the territories, and simply because we need to address that, then we can see what's missing in the disability space from our end. So we did advocate a lot for the disability, but we noticed that it was more than just a disability community. It was the territories that, as a, in general. One thing I did find is that as islanders, I think from the tsunami, we were told 3 years after you got your financial assistance that you had to get a national flooding insurance. So, flooding insurance, and you live on an island, right? As I dug into the research on that, the history around the National Flooding Insurance Act, it started in the late early 1900s. And the whole report that led to this congressional statute, to this act, there was so many citation of the cost of flooding, disaster, all these incidents, but none of them included the territories. So I just thought it was interesting. Now we're held, to this act that existed, and they probably didn't even know we even existed. So, there's so much disconnection. And I think another conversation about the inclusion in itself in general is that how much it costs to be included to ensure that we have an equitable outcome. So there's always a cost just to be included. And that could be a good or bad thing.
Absolutely. So many lessons learned. Any other questions?
There's one here from Ginger, NDPTC. What are your thoughts on the role of telehealth in disaster response and inclusive planning? Good question. I mean, technology is often, the current technology being used right now during a disaster and response recovery is that, you can use drones nowadays, right? When you can't reach certain places, you can apply drones. And in this case, regarding telehealth is such an overlooked space when it comes to disaster. And take, for instance, during COVID, we could have done so much to make sure services were delivered via telehealth. PT, OT can still be delivered uninterrupted in a isolated space. But I think this is the part where we need to start integrating it. Where do you put it in a territory emergency operation plan? Telehealth may not be just a responsibility of the Emergency Operations Center. It can also be a responsibility of an agency who is a Medicaid provider. The whole point is that you want to make sure access is still present in a time of isolation, in a time of disaster, in a time of response and recovery. And I just cannot know how much the valuable existence of telehealth can do during an emergency or disaster declaration. The one thing I want to say that's in the one of the recommendations in the FEMA Advisory Council report is that now they have a new, there was a recommendation to have a new emergency support function, to have EMS have its own emergency support function. So this is good because then we can pay attention to that. How are they responding to people with disabilities at the home, our mom and our dads?
Mm-hmm. Fantastic. Thank you so much, Tafa. We just want to thank you. We're so grateful to you for serving in these capacities that you are and raising awareness to these raising attention to these issues. We will stay on a little bit longer in case anybody has individual questions. Max has dropped into the chat a link to a brief feedback form if folks don't mind going ahead and filling that out for us. We very much appreciate that. And Tafa, thank you so much for your time.